welcome.
Thank you. So happy to be here.
Very excited to have you here. I feel like we've already been talking about so much good stuff before we started recording. And I was saying to you, like, I could talk about this stuff for days, all day, all day. It's so hard for me to keep these episodes short, but I think we've been following each other for a while, and I am just really excited to talk to you today about all things
so excited to
beauty
be here.
and aesthetics.
Thank you. It's my
So
pleasure.
something I wanted to ask you to start out is about your aesthetic philosophy. I feel like everybody has kind of a different approach, and I see providers almost as like designers. I remember Dr. Ben Talley said this once. He's like, surgeons are kind of like designers. Like, you're going to get a different style depending who you go to. And I think that goes for aesthetic providers as well. So what is your approach?
I think my number one approach, and I think that does reflect upon my style, is honesty. And then I would say less is more, a more natural approach. But honesty is my number one. I want to call it style because I refuse to treat a patient with anything that is not going to really give them benefit or a true change, the change that they're looking for. I won't just do something to do it. And I think, unfortunately, in my field, that's way too common.
Yes. And I feel like when people think of things like Botox and fillers and some of these less invasive treatments, they think of the stereotype, right? Which is like completely frozen face, which nothing wrong with that. I miss my frozen face. But yes, over-injected. I think a lot of people, use things like filler maybe for the wrong reasons. They use filler to like lift or provide a lot of volume, instead of just like shadows and kind of that nuance. And I think also like Botox, you can go way overboard as well. What do you think are some of the kind of common mistakes that people make when it comes to their injectables?
Big mistake is the idea of lifting with fillers, because the average female, so maybe you and I, because we know so much about the industry, when we think of a lift, it's millimeters. But when we say lift, the average female or male listening on the other side is imagining a actual physical lift. And then when they come into my clinic, that's what they're expecting. And so I literally get TMJ pain all day just talking about, and Kelsey knows, a dry throat and neck pain, simply talking about the fact that you cannot get a physical lift with fillers. The amount of filler that I would have to put in someone's cheekbone to get a lift is insane. And so that's one of the number one mistakes. And then now, just unfortunately, because social media does play a big role in our lives, and it affects, I think, almost every field that you work in. It affects us a lot because the expectations that people come in with because of either filters or things they've seen on social media, and then me having to talk them through and out of it. And sometimes I think that the average patient might think, well, you don't really know what you're talking about because look, I see on social media, this is attainable. And then the rest of my consult is given to things like, well, no, that's a filter. If you close up, you'll see that no one really has poreless skin like this unless you're blessed. But yeah, I think that a lot of social media can really negatively impact what we do for a living.
Yeah, I've heard you talk about that before. And I heard you say something interesting, which is that people aren't really bringing in pictures of models or celebrities anymore. They're bringing in filtered
photos of themselves,
which is crazy. I would imagine that kind of started with Snapchat. Like,
Absolutely.
I remember those filters and it was like, whoa. I mean, I never used Snapchat except for the filter. And I was like, my chin was a little smaller. My nose was a little smaller. My eyes were a little bigger. I mean, it was like uncanny,
Yeah.
But I think that, and I remember hearing this from plastic surgeons too, like saying that people are bringing in filtered pictures of themselves. Yeah.
It's unfortunate because and again, I go to so many like teachings and conventions and trainings. I was just in Switzerland for a training in Miami after that.
Were you at Julie Horn?
I flew all the way to Norway for her.
My friend went to that too.
No way. Yeah. I went to a one-on-one with her.
Okay. Yeah. That's what she did too.
That was just a dream come true. I really look up to her.
Oh, you got to do my lips now.
My pleasure. But it's definitely sad because years ago, because the industry is really infiltrated now.
Mm-hmm.
I think 7 years ago when I began, it wasn't that infiltrated because I remember I was the only student in my cohort, and there was 150 students in my cohort, that when you were asked to introduce yourself at what you're going to do with your nursing degree, at the time I was studying to be an RN, I was the only one that raised my hand and said, I want to be in plastic surgery in Beverly Hills, because that world interested me so much. Everyone else had an amazing story about helping sick people. And I was so judged for just being like, I want to be in plastic surgery.
Yeah.
So back then it wasn't as, I read somewhere that back then, 7 years ago, there was 26,000 injectors just in Los Angeles County. That is insane.
Wow, that's staggering.
But years ago, we were showed pictures of a celebrity, but now it's just a filtered photo. And what they want is just so unrealistic. And some of the words used, like, want to be snatched. And I just don't even know what that looks like.
Yeah.
It's just, like this wooden jawline that doesn't exist. And we're just coming actually from like a really good a medical office. And we were just talking about that, how it's portrayed so incorrectly. And I think that as injectors, as medical professionals, doctors, nurse practitioners, we really have to be aware of the words that we use when we are talking about certain treatments that we're doing. A machine like Morpheus, which is a wonderful machine for skin rejuvenation, right? It's microneedling with radio frequency, causing thermal injury and trauma with needle to really improve the skin. Fine lines, wrinkles, minimal lifting, tightening of the skin. It's literally now like a facelift in a machine. That's what it's looked at. And it's just so unrealistic. I recently had a patient that was concerned about submental fat and asked me if Morpheus would get rid of it. And I said, no, maybe if you have a little bit and it's dense fat, I said, you really, in my opinion, and I've worked in plastics long enough side by side with a surgeon to let you know that I think a little bit of liposuction and possibly a lower neck lift. She didn't listen to me. She went to somebody else, paid $3,000, had Morpheus done. And then 6 months later came back to routine, my med spa, and said, I did it and I spent $3,000 and I didn't see results. Said, do you know how easy it was for me to tell you to do Morpheus and just rob you of $3,000?
Yeah.
So easy.
Yeah.
And that's what I mean by honestly, like I just won't do it because the last thing I want to hear is you took my money and I don't see results. My ego is just too big to hear that on it, because I do what I do because I love it. I don't have to do it. And so the worst thing to do is just take someone's money. I had a patient come to me recently and said, she went to another med spa and someone told her it's about to change your life, the treatment. And then to hear these patients and say it didn't change their life, you really learn to not do that. Realistic expectations.
Yeah, I think that it seems like every year there's something that's kind of trendy and marketed as like the panacea for every issue. And I feel like Morpheus was kind of one of those where people think, oh, it's going to lift my face. And I've had so many providers on my show who have said like, yeah, it's great technology on the right person because it largely depends on your body's own ability to produce collagen and heal, and everybody's different. I have thin white girl skin. Like I have to be really careful with radio frequency. But for other people, it can be amazing. For the right concern. It's not
right
just like
concern, right patient, right skin. I tell my patients, new patients in consult all the time, I can have 10 patients and I can do Morpheus on all 10. 6 might say to me, oh my God, Anush, everyone's asking me what did I do to my skin. My husband says, what did you do? You look so good. And the other 4 might say, I wasted my money. I don't see any results. And that applies to almost every treatment in aesthetics, and so the body, everyone's body reacts different, everyone's skin. So for example, I don't do PDO threads. I just don't do them. I've never really seen great results from them, but I'll always say that there are certain patients in certain areas with a certain skin type that might benefit greatly.
Mm-hmm.
But overall, threads, no one's walking around after you pulling those babies up. They settle into your skin, fat, and muscle. And, you know, I'm not into threads, but that's just such a great example.
Maybe that's what I need right now is threads and somebody just holding my
Botox,
brows up and my crow's feet. Just follow. Yes.
Yeah.
Listeners are like, what?
Just even crow's feet Botox is such a great example because, you know, someone might have such a strong, nice pull at the tail of their auricularis. And you do a little bit of Botox and they get the nicest lift.
Yeah.
And then someone will see that and, you know, oh, Anush gave me that lift. And then they'll come to me and I'll ask them to squint and there's such minimal muscle activity. You're not going to get the same lift that Mary just got, you know, because your muscles are different.
What about mine?
Oh, I'm like looking at, I would love to do about 12 units per crow's feet.
12 per?
Yes.
I know. That's what I used to get. 12 or like 15 per. Yeah. Got to start small. They're so bad.
We'll do four units at a time and see what happens.
Would 4 do anything?
Just to see what you're
I'm just holding it like
to see how you're going to react. I'm scared.
Wait, would 4 do anything?
I mean, look,
let's talk about dosing for Botox.
So let's talk about dosing because that's another funny thing. Me and another provider earlier were talking about. He said when he sometimes tells patients how many units they need, they'll be so surprised. And he's like, oh, I didn't know you had letters next to your name. Like, is that what you do for a living? Sometimes I'll tell a patient, oh, 48 units. And they're like, oh, really? I'm like, oh, what are you comparing that to? Like, is that a lot to you? Or do you know how counting units costs? So we'll assess a patient in person and based on their, you know, first of all, you look at the area that you're injecting, right? Some people have a bigger forehead than others. Based on how strong the muscle is, based on how large the surface area is that you're injecting, then you'll count units according to that, right? So you might furrow, which is, you know, get mad to show me your 11s. You might have like a very tiny, thin muscle. And I'll say, oh, you know, that's just 11 units. We'll knock that out. And then someone else might frown, male or female, and it's just a chunky, it's a fat muscle. You can actually physically grab it. That muscle is a stronger muscle. It means it needs more units. But what a lot of people get confused about is they'll say to me, oh, can you do less so I'm less frozen? What a lot of people don't know, and that's normal, is that dose equals duration. The more I do, the longer it lasts. The less I do, the faster it goes away. So if you have a smaller muscle and I do 13 units and I have a little bit stronger, I do 16, you and I are still not going to frown the same exact way. It's not that Anush has more, so I can't frown harder than you. But our glabellas are knocked out. We can't frown. So if I do 100 units on you, again, we're not going to frown the same way, but you won't frown for maybe 4, 5, 6, 7 months, way longer than me. So the frozen aspect is really, it applies to the forehead because it's the placement of your Botox. The higher you put your injection points, the more the eyebrow muscle is still going to be active and you could lift and relax.
Yeah, you're not frozen.
Yeah.
Like you have movement,
so
but you
my
don't have
eyebrows
lines.
still move. But the minute I inject a little closer to the eyebrow, that's when you're either heavy, drooped, or fully frozen. And look, some women want absolutely no movement and some women don't. If you're a new patient to Botox, I always inject up higher. I allow the movement because I can always bring that down 14 days later. But if I droop or freeze you, there's no going back. You just have to wait until the Botox wears out. But that's something I tend to not do a lot of teaching on my social media. I leave that to just a one-on-one with me and the patient in the consult room.
So when it comes to getting a neuromodulator, I think another thing, I mean, you can speak to this more than me, obviously, but I think a lot of people go in and say, I just want to do my crow's feet or I just want to do my forehead. Do you recommend doing the whole face? Because I feel like it looks more obvious if you just don't move your forehead or you just don't have crow's feet, but then there are other areas. Like it really involves balancing.
Especially when it comes to the upper third. So your frontalis, your glabella, and your orbicularis, those 3 muscles are anatomically woven in together. So when it comes to the upper face, they work harmoniously together like a yin and a yang. One is a lifter, the other 2 are depressors. Imagine if you only do your forehead. I have patients that say, just my forehead lines bother me. Well, that's your only lifting muscle. If I do any neuromodulator there, I am depressing your lifter. And so this is now depressed. this is active, we didn't touch it, which is a depressor, and your orbicularis is a depressor too, right? So now everything's depressing. So if you are going to inject the forehead, then you want to relax your two depressors to lift them up. And so I always say, do them all together. Now, if I have a 20-year-old that barely has any crow's feet, I may not touch it. I may just do between the eyebrows, the forehead, and we're done. But now you can be 20 and 18 and frown or squint and have very strong muscles. So sometimes age doesn't play a role. It's genetics, you know?
Yeah.
But most of the time you want to address all three, because if you knock out one and not the other two, or if you knock out two and not the other one, the one that is active will overcompensate. And over time, not just with one treatment, but over multiple treatments, the one that you're not treating will get stronger and you'll have stronger lines there. And so I always say, you know, you don't have to freeze it. You can just sprinkle a little. If it's a light muscle, just soften it up, but still do all three.
It's so interesting because I was on a plane and I was watching my best friend's wedding, Cameron Diaz, Julia Roberts.
Movie. Of course.
And I was watching it and both of their foreheads were fully moving, full lines, full crow's feet when they were moving their face. They weren't static, they were dynamic. But, you know, I'm sitting there and I'm like, what year was this movie? And then I'm like, how old is Cameron Diaz? Minus 1994. Like trying to figure out how old she was. And I'm like, they were in their she was like 24. And Julia Roberts was like 27. And that was whatever, 30 years ago. But it's so interesting what has happened between then and now, because now like you just don't see that, at least in a place like LA. And also I was watching like reruns of The Hills. I don't know if you remember that show.
Of course I do. We were just talking about that.
I'm like, they're beautiful. They're young, but they had like full crow's feet and full like static lines in their forehead. And it's just crazy. So that's interesting to hear that people come in their early 20s now. Is that just preventative, or like you said, genetically, some people just have more movement?
I think that this era, the new younger generation, because everything is so just open and out there on social media. Everyone's I have a 13-year-old that's into skincare. And that's because of me. She doesn't necessarily have social media. But I think that over the years, I've realized that the younger generation is really getting into it a lot sooner. And look, with some things I disagree with, but other things I've said this before, if something is a real insecurity and it's bothering you, right? So if I have an 18-year-old that's brought in by their mother and she has or he has really thin lips and it's really bothering the kid, who am I to tell them that you shouldn't be doing your lips? I've said this before on many platforms, I'm Middle Eastern, I'm Armenian, and in my culture, rhinoplasty is a very accepted surgery. Right. When you're 16, 17, 8, very young. And that is a whole surgery that's changing your whole face. Fillers are not permanent. They're temporary. They go away. So if a rhinoplasty is accepted at 16 and 17, why isn't a little bit of lip filler, And I have many family members that have rhinoplasty at a young age. So if it is an insecurity, as long as it is tastefully done, then there's absolutely nothing wrong with doing it. And yes, I do have some 18-year-olds or 19-year-olds that furrow, and that muscle is so strong. You know that by the time this kid is 20, 22, 23, 24, it is going to be indented. And so once a year or once every 8-9 months, knocking it out just to soften it, there's nothing wrong with that as long as it's done morally and ethically correct. That's my motto. I think that I'm no one to judge. This is the field that I chose. And if I'm going to make someone feel better, I turn away women on a daily basis, no matter what their age. If something is too overdone, I'm either going to say I won't do it or let me dissolve it, because it's not about size. The shape needs to be done beautifully. I will not accept a young patient in my chair telling me, make me look snatched. Like that, stop. We're not going to do that. But certain things, if it's bothering someone, if I can make them feel better by helping, I definitely will.
Yeah, and I think it can be so benign, like you're saying. I mean, I think that people do, to your point, they do rhinoplasty at 16. I mean, I remember when I was in high school, even people were doing it.
My
young.
sister did it in high school.
Yeah. And now people are doing like, even like an endoscopic facelift, like Dr. Ko, you know, he's like, this is a beautifying procedure, like a nose job. That's what he compares it to, obviously, way more invasive. But he's doing that on young patients as well. And that's like a whole, you know, intense surgery. So I think, like, to your point, Botox, filler, things like that can be much less invasive.
Subtle and much less invasive. And I think that as a good provider, your consultation, you really start to learn the psyche behind it. When I was a new nurse in plastics, I used to have, you know, the doctor that I worked with had like gorgeous models coming in, and he'd give them the mirror and tell them what's bothering them, and everything was bothering them. And I was so new to the world of aesthetics, and I didn't really understand much about mental health at the time. And they would complain about so many things, and all I would stand there and say is, "But you're so beautiful."
Yeah.
And one day, I remember he got mad at me. He said, "You need to stop saying that, because yes, they are beautiful, but they don't see that when they look at themselves. And by you constantly complimenting them, you're not helping. You're making them feel bad,
like invalidated.
You're invalidating them."
Yeah.
And that took me so long to understand. And so as an injector, and I see 20 to 25 patients a day, so much of what I do is therapeutic in that room. I mean, Kelsey will tell you it's, you know, you don't want to invalidate them, but you also don't want to feed into it, because you don't want to inject something that doesn't look like it needs any more filling. So a lot of it is internal. I probably have some body dysmorphia. You know, nothing is ever good enough for me. And if I say it out loud, people think I'm fishing for a compliment, but really I don't see it the way they do.
Yeah.
And I'm really hard on myself. So a lot of the women that I see on a daily basis, it's a lot of talking, and explaining to them. And I know that if I say no, they could easily go down the street to another injector. But I feel better sleeping at night knowing I didn't do what, you know, because they really didn't need it.
Yeah, I know. I see my face on video from like last summer. I was so frozen. I mean, it was amazing. I was so frozen though. Everything from my forehead, my eyes, my bunny lines, down here, my neck. And I remember people at the time were like, "Your face is frozen." And I was like, "No, it's not." And I would find something else that, you know, I would be like, "Oh, but I have this line here." And like, and you start to nitpick. And now, as you know, like, having not really had Botox since August, my face, I feel, looks completely different. And I have movement and I have lines and everything. And I'm like, God, like, I just have a different perspective now, where I was like, yeah, I was kind of like dysmorphic about that, you know, because you do start striving for perfection. And now I'm just like, I would just be happy if I could just do my eyes. Like, that's all I want.
I'll take a little bit of crow's feet Botox.
Yeah. But it is a slippery slope, I think. And I feel like the most beautiful people that I know are the most critical of themselves. It's like you could do like a chart or something, you know, it's like the more attractive you are, the more dissatisfied you are with your appearance, which is so interesting.
Yeah, absolutely. I would agree. I think all my patients are beautiful, but the ones that are like super well taken care of are the pickiest.
Yeah.
And it is a slippery slope. It becomes an addiction. It's like getting one tattoo and then all of a sudden your whole body's tatted up. But I think that that's when you have to choose the right provider, so that when you are sitting in that chair and you are starting to think that your lips have gone down, but really they haven't, they're not just going to they're not just going to see dollar signs. They're going to let you know that no, they're not, they haven't gone down. Let's look at some before and afters. And I know so many injectors that I've never had my lips done. If I sat in front of them and I said, you know, I just wish they were a little plump, let's do it.
Yeah.
But you need to find someone that's not just going to say, let's do it. Look, I love cheek fillers. I have a lot of cheek fillers. But I don't want to go to someone and just say, God, I'm not happy today. Let's do some cheeks. And they're just going to be like, let's do it.
Yeah.
No.
Okay, let's talk about filler, because you mentioned earlier filler goes away. Obviously, we're hearing now like filler can actually last for a very long time. How do people go about getting tasteful filler? Like, what is your approach when it comes to that? Because you just mentioned you have filler in your cheeks, but you don't have that typical look.
Overdone. And I
Yeah.
have a lot. I mean,
Really?
I'll be 40 this year in a few months. I started when I was 30 and I've always had a long, narrow face, but not really like full cheeks. And I like to be skinny, but when I'm skinny, my face, the fat in my face depletes.
Yes.
So I want a little bit of volume in my face. I gain a few pounds, my face looks good, but I don't like my body.
That's my exact thing. And I got fat in my face and I was like, I would rather like feed the fat and have that extra 5 pounds and have my face be plump
fuller
than be skinnier.
But with that being said, you don't want to overfill. Back when I started in this industry, I was not an injector. I was assisting a surgeon who injected full time. And I realized I could be an injector simply by watching what he's doing. I realized I had the eye for it. And it's not just about being able to hold the needle or just deciding I'm going to be an aesthetic. You really have to have the eye, and you learn that really everyone doesn't. You can be very knowledgeable, know the anatomy so well, but if you don't have the eye, you're still not going to, you're going to know where that artery is. And you're maybe not be able, you're not going to cause an occlusion or do anything wrong.
Yeah.
But it still might not be put in the right place. So when you have the eye for it, you make sure you just, I don't know how I'll say, you make sure you don't over inject, and fillers can stay for years. I know that they've looked at ultrasound fillers from 14 years ago and it's still there.
Wow.
I've done my cheeks multiple times over the past 10 years. I haven't touched them for a year and a half, but if I don't touch them for an even longer time, they will be there because they're layered many times in close increments. I have patients that'll come to me and want more lips, and I'll be like, well, your lips are already too big with the proportions of your face. And they'll say, oh God, I haven't done them in 2-3 years. Okay, well, how many times have you done them in the past few years? Oh, 7, 8. Okay. Have you used Juvederm Ultra Plus? Yes. Well, there's still filler in there. I'll be like, no. I'm like, yeah, I can look at it and see there's filler there. And then we'll dissolve it because it's migrated or whatnot and maybe start from scratch. But I just think that overfilling is like the worst thing that you can do. So again, going back to less is more. No matter what area you're injecting, whether it's tear trough or, mid face, you don't want to look like filler face, like a pillow face.
How do you keep it from migrating in your cheeks?
Not every area migrates. Some of the most common areas that migrate are lips. You're constantly moving them, The eyes can tindle and migrate. My cheeks have never migrated. They're down on bone, Voluma, Juvederm Voluma. It's a thicker filler. It's never migrated. My tear troughs, I didn't think they migrated. Recently, I went to Dr. Arthur Swift in Miami. We have a cadaver dissection in Miami I went to. And my under eyes have been done 7-8 years ago. My second daughter is 7.5. Gia is almost 8. I did it after she was born. And I'm like, well, I told him, I said, I think my under eyes look great. And he goes, well, I could see a little bit of sausage filler.
Wow.
Tyndall effect that's come out. And back then, Juvederm was used under the eyes.
Right,
and every year
thicker.
It's a little thicker. I mean, I still think they look great, and I'm not going to dissolve them. And, sometimes you're chasing the rabbit's tail. Some areas if it's not broke, don't fix it. You're going to dissolve, then you're going to refill, and then you're going to dissolve. You're never going to be happy.
Yeah.
And I've learned myself, I'm in the field, right? So I do this all day. It's very easy to get kind of, oh God, should I do a little bit? It's been so difficult. I mean, I'm happy with my lip size. I've always had thick lips, but sometimes you look and you're like, oh, I'm almost 40. They've depleted. Should I do it a little? It's very easy to fall into that. And I've learned, and a lot of it is seeing other patients and how they're not happy with the aging process. I've learned to really accept some things. Not everything can be fixed, and you shouldn't hold a mirror this close and say this little line bothers me. Some things we have to be happy about, and if you can minimize it and age gracefully, and it's all very subjective, but I think that it's more healthy to just be okay with a lot of the things, because it's never going to be perfect. Some lines occur upon movement, when a dynamic, and you don't ever inject based on movement.
Yeah.
If I tell patients all the time, I could do your smile line, but the minute you talk or smile, it's going to indent again.
Right.
So I just think that keeping it more on the subtle, natural side is always better.
So when it comes to aging, I would imagine eyes are kind of the first place that we see signs of aging, and then maybe like jowls. I know that a lot of,
Yeah.
So let's talk about that, because I think, that's where a lot of like the radio frequency comes in, and threads and filler, and using filler to try to lift the jowl. And what are non-invasive or less invasive options before it's time for surgery? You have an amazing
talk about
jawline.
this all day. Thank you. I have both my parents age very well, and I have thin skin. But my dad's 65, no jowls. My mom is 63, barely any jowls. So I think it's my genetics. My sisters and I all have very strong jawlines. But there is only so much we can do at a med spa with jowls. I have this conversation all day, every day until I have dry mouth. And so a lot of it is just, we turn to surgery for it. I can, pre-gels are starting. We could put minimal filler to just kind of camouflage them, maybe a little bit of radio frequency with microneedling to dissolve a little bit of minimal. But really all we can do is camouflage. There is nothing, and I repeat, nothing in a med spa that is going to physically pick up your skin and lift it. I don't care what anyone tells you. It's not going to happen. So there is a point where you just have to turn to surgery. And that can be like Ben does his
weekend lift.
The weekend lift.
Yeah.
I have 3 patients that I referred to him to go do it. Young, in their mid-40s, looks phenomenal. A patient that's 46 and flew to Jacono in New York and had it. It looks phenomenal. She has jawline of an 18-year-old. She's 46. But it needs to be, all this whole facelift with Botox, neck lift with Botox, the Nefertiti lift. Yes, if you have, certain individuals have very strong platysma bands. You do it, they'll get a minimal lift, looks nice, but it is a realistic lift. You are not going to, if only all providers were on the same page and we just all stopped saying you're going to get a facelift with Botox, because they're not. And yes, one of your patients might have had a great result because they had stronger bands and you you relax them with Botox and they got a nice lift. But it does not apply to everyone, especially if it's sagging skin and it's not just the muscle pulling down. And I don't want to toot my own horn, but because of the fact that I had 4 years of experience with a surgeon who did surgery in the mornings and injected 9 to 5, and I was able to hear him do consultations all day, I really understood what needs to be fixed with surgery and what can be improved with filler. And it's not just, here, I have a syringe in my hand and I can just fix it all with filling your face. Right.
Like when all you have is a hammer, or when all you have is everything's a hammer. I know I'm butchering that.
What was it?
What is it?
If all you have is a hammer, then everything is a nail.
Or the other way around.
Or something like that. But everything is a nail when all you have is a hammer.
When all you have is a needle, then everything is.
Yeah. And that's not true. And I think that being honest and telling someone, listen, you don't want to spend $1,000 on a syringe right now and look, if money came easy to you and you don't care about that $1,000 and even a 20% improvement is going to help, let's do a little bit, but you're really not going to get that wow factor. And it's a stab at my ego if anyone looks in the mirror afterwards and they're like, oh, this was it. So I explain, a lot of it has to do with the consultation. You just have to set realistic expectations.
So how does somebody know, like if it comes to their brows, for example, how much can a Botox brow lift achieve? And when is it time for something like an endoscopic brow lift? And the same could be, said for under eyes. When can you use filler versus when is it time for a blepharoplasty?
So with the under eyes, it's very easy. And again, if you have a knowledgeable injector, they can show you very easily, hold the mirror and they'll show you if you have fat pockets, it's herniated fat because the muscle wall is weak and the fat is pushing through. That needs to be, a lower blepharoplasty needs to be done. The fat pockets need to be burned because if you add filler, that's just going to make it worse. You're going to have swelling if you don't sleep all the night before, you eat salty or spicy food, you're going to be swollen. That's just like a quick fix. And so I'll always tell my patients, the issue is the fat pads and you need surgery. And if my patient tells me, listen, I'm not going to do the surgery for another year or two, I still won't inject Because if I inject and they spend money with me, they go to a good surgeon, Parsa, Groth, Taban, under eye. That doctor is going to dissolve every ounce of the filler that I did. So now we're going ass backwards. You're going to pay that doctor. You paid me. You're going to dissolve it all. So I consider all of that. Like just as a human, you have to consider all that. Don't make that person pay you to do something that's going to be reversed later on. I had hollows under my eyes, so I benefited from filler.
Right.
But if you have fat pockets, you're not going to. Excess skin. You know, you can fill it all you want, but if the skin laxity is not there, if anything, it's going to show through, then you're not a filler candidate. And when it comes to Botox, you know, you get a minimal lift. And that again has a lot to do with how strong your muscle is. If you squint and it pulls down a lot, it wrinkles a lot, just a little bit of Botox will give you a minimal. So if I have a patient that asks for this, yeah, you need like a canthal, you need surgery.
So what are some other things that people maybe overlook when it comes to aesthetics? Like
skincare.
Thank you. I was just going to say, like, your skin is your canvas, right?
Absolutely.
So all of these things can only look so good if you're not taking care of your skin.
I often will get complimented by my patients and they'll be like, well, you don't need anything. First of all, I'm turning 40.
Right.
And I'm like, well, I don't need anything because I do it all. Like you don't see the behind the scenes. Like I'll stay after work or come early and do my own CO2 or do my own microneedling or
dream.
You know, Botox and all that stuff. I don't have the luxury of all that time often, but my skincare, and that's why I gravitated to you so much. Your 9-step skincare kills me, but it is so important. It's like, imagine I'll have patients come in and want to do CO2 or want to do microneedling, spend $850 on CO2, $1,000 microneedling with PR exosomes. And I'll be like, oh, do you wear SPF? No. Well, then don't waste your money with me. Go buy $35 Ulta-MD, you know, don't go ass backwards. The homework that you do every day at home is more important than the hundreds or thousands that you're going to spend with me. Because if you do a CO2, but you're not using your SPF, guess what? You're going to make your hyperpigmentation worse, your sunspots, and then we're going to go through the hand-holding process. So it is so important. It's not just about filling your face, but taking care of your skin and again, I have patients with great skin, but there's no complexion. It's dull. My older sister has flawless skin. She makes fun of me all the time because I've spent so much money and time on my skin. She's like, I wash my face with a bar of soap and put Medicare butt cream on my face. I'm like, yeah, but you're genetically blessed. But there came a point where I'm like, Anna, you need to resurface your skin. Yes, you don't have scarring and yes, you don't have acne or dark spots, but your skin is dull. It doesn't have that glow and complexion. So until I got her to start using peel pads and retinol and vitamin C, and then a year in, she's like, oh my, and what a lot of women also don't know is it takes 6 to 8 months of using an active in order to even see a difference in your skin. So once she started using it, she's like, oh my God, I can't believe I had such dull, dead skin on my face. So actives, look, you can use, I ask patients, are you using good skincare? Yeah, La Mer. I mean, are you using actives? Your vitamin C, your AHAs, your BHAs, your retinol. Those are really the 3, and your SPF, 4 of the most important ingredients that you need to use. Using some cream that came from a squirrel's butthole from like, I don't know,
placenta
isn't going to do anything. Yeah, that's fun. Yeah. It sounds fun. But, retinol, vitamin A, it has like the most amount of clinical trials reverses photoaging and all that. So that's that for me. I spent all of COVID on my social media teaching women how to wash their face properly and applying skincare. So I'm huge on that.
Give us a minimal skincare routine.
Morning, vitamin C, my antioxidant, I apply it during the day. Moisturize, SPF. That's morning.
Okay.
Retinol, depending on whether or not you're a retinol user and your age or your skin condition. 3 times a week, retinol followed by moisturizer. And then once a week or twice a week, depending on how sensitive your skin is, you want to exfoliate with peel pads, moisturize, go to bed. The other nights, moisturize, go to bed. Like that is probably minimal. You and I were,
I'm like, ooh,
we're unique. The 9 steps.
Yeah. I love it.
You got me onto that Jan Marini glycolic.
that cleanser changed the game for me. I had very sensitive, dull skin before.
Your
I was
skin
like
is glowing.
Thank you. It's very dry and dehydrated right now because traveling. I was in Vegas.
I saw.
But yeah, I mean, it totally changed my skin because I wasn't using, it was so sensitive to the point that I kept taking things out.
Mhm.
So I wasn't really using actives. And I would have like, when I washed my face every day, like my skin would pill because there was so much dead skin.
Mhm.
And then I wasn't moisturizing. I was just using serum. Like it was just bad. So when Candace put me on Jan Marini, I was like, whoa, this is like a lot of actives. I'm throwing a lot at my face, but it just like changed it.
Mhm.
And
Your skin's amazing.
yeah, thank you.
As long as you know what you're doing, you know, there's people that'll mock like a really long skincare routine,
Yeah.
but as long as you're educated and you know what you're doing.
Mhm.
And I've learned that the average female does not want to do that, you know?
Mhm.
So when I have like a rep come tell me about the TNS from Skin Medica, and I'm like,
Mhm.
do you know how difficult it is to get the average female to do vitamin C, moisturizer, and SPF during the day?
Mhm.
Oh my God, so many steps. Now try getting them to do an essence and your retinol and this and that. The average female does not do what we do.
Mhm.
And everyone's not into it, but
Yeah.
I'm really big on skincare.
Yeah. Yeah. For me, it's like my self-care time, but I've gotten it down to 3 minutes. I'm like,
Yeah.
boom, boom. Like
It
people,
can be done so quickly.
Yeah.
When people tell me, how long does it take you to get ready? Quick.
Yeah.
I love my self-care.
Yes.
I have kids. It's a hectic in the morning. So
Yeah.
I wake up super early, 5:30, do my thing, have my
Mhm.
coffee with the birds.
Mhm.
People make fun of me for it, but it really calms me down because I
Mhm.
have such a big day ahead of me. You know,
Mhm.
treating and talking to and injecting 20 different personalities
Mhm.
is a lot.
Sounds exhausting.
Oh my God. My husband makes fun of me when I get home. He says, this is me. My ears start to burn.
Uh-huh.
My neck hurts. My
Yeah.
throat hurts. My TMJ hurts, and my head
My
hurts. So he says, I touch every part of my upper body.
I love you. You're hilarious. We're like the same person. That's how I am. If I do like back to back to back podcasts, I'm like, I need to go sit in a dark room alone, not
I've
talk
laid
to
down on my
anybody.
closet floor.
Yeah.
I'll
That's
come
like
home,
what I did
lock my
yesterday.
door. My 13-year-old and my 7-year-old will walk after me.
Uh-huh.
And I'm like, the babysitter is mom.
Oh my God.
Do not even say my name.
Yeah.
I'll put my hatch, like the
Mhm.
white
I
noise.
love the hatch.
Yeah.
So
And
good.
I've been on the closet floor.
Mhm.
I fell asleep once on the closet floor.
Amazing.
I asked my husband, why didn't you come looking for me? He said, I did. You were sound asleep. I didn't want to bother you. What?
Self-care, baby.
Yeah. No, and with kids and a career
Yeah.
and you try to manage a social life in that. And
Yeah.
then I love this world too. It's a
Mhm.
lot.
Yeah. Well, you do it so well. Thank you so much for coming
Oh
on.
my God, thank you.
So
for
fun. We
having
could
me.
keep going, I'm sure, for hours,
Oh,
but
yeah.
tell everybody where they can find you.
So I opened my own med spa in Studio City. It's called Routine by Anush Movsesian. And then you can find me on Instagram at skinsandneedles_NP.
Thank you.
Thank you.